It comes down, it's a very good question because it comes down to this. Does someone's need therefore create a right? Does someone's need create a right? And I submit it does not. Someone's need does not create a right. And I'll also add there's another part of the economic context of this too. Imagine if healthcare were akin to computer pricing today. I mean, I see lots of poor people and they have computers, they have iPhones, they have two televisions, have access to transportation. Why have these things not risen as fast as healthcare? And I'll submit it's a big reason is increasing government involvement in healthcare. So pulling government out of healthcare and allowing people to make private decisions would allow the prices to correct. And would give people access. If poor people need healthcare, what's the one thing I do? I let Walmart open healthcare clinics. Any place they want. They've done marvels with eye exams. When I was your age, if you needed an eye exam, you went to an optometrist. If you needed something more serious, you went to an ophthalmologist. You got a prescription. Then you went to an eyeglass store. And it was at least 3 steps to get a pair of glasses. Now I can walk into Walmart without an appointment at times. A doctor sees me, makes an evaluation. I walk out with a pair of glasses at a price in relative terms that's about a third what it was 30, 40 years ago. That's an example of what would happen and what would be available to people. But I think the core moral argument is, and you can come back to me and disagree with me, because a lot of people do, I'm welcome to hear that, is that a need for something does not create a right, and therefore a right to enforce it as a duty against others. Someone needs health care as I do, the first thing I'd acknowledge is that I need my doctor to get it for me. So how does that give me a right to control him? I'm the one in need. So we're going to go back here. Go ahead.
Just a follow-up on that. Given the state of healthcare before the expansion that you were talking about in the 1960s,
yes.
Because you can compare before where the elderly care in the country was such that, according to the AARP, there was 35% of seniors lived in poverty, and over half of them didn't have health insurance. Mm-hmm. So, can we really rely on things like charity and the free market when those solutions obviously didn't work? And since then we've had seniors' poverty rates go down over 2/3, over 66%.
My question to you is, why are you trusting the AARP? I mean, those figures don't match any personal experience or anything I knew from the 1960s. During the 1960s, other studies have shown that healthcare was more evenly distributed among the population than it is now. You could go to a doctor and for $20 or $30 pay for your visit. I didn't know any elderly people in my family, including immigrants from Italy and Portugal, who went without health care because they didn't have insurance. It's only in the modern day, you see, that insurance has been equated with having health care. If you don't have insurance, you don't have health care. And of course, one reason for that is the massive rise in prices. If we want to talk about what's happened from the 60s, we have to acknowledge 2 things, I think. One is that if you want to give yourself the kind of care that was available in the 1960s, go home and give it to yourself. You can do it. Because what's available today is so much further. When I think of what was done to me, back then there were no MRIs, no CAT scans, none of any of this. And surgery was risky and dangerous, even simple surgery. So we'd have to add that into the context. We'd have to say, what is the source for all of that? And it is not government force. It is rising medical competence and knowledge among doctors who choose, and researchers who choose to follow this path. And the second thing I would note, going back to the 60s then, is that notice how the rise in prices has followed directly. Don't trust the AARP. The AARP over the last 5 years has become a massive insurance company. They're insuring millions of seniors, and one reason they signed up for this bill is so that they can get millions more on their insurance rolls by getting a piece of the government action. And there's even a broader point to be made about these organizations. Don't trust any of them without validating what you're seeing. The AMA has made statements about what its members think. It's very clearly to me from every direction. When I talk to AMA members, I know a Duke doctor resigned from AMA over this. The AMA is not reflecting necessarily the opinions of its members. In many cases, its members weren't even asked. I saw the Colorado Medical Association issue statements on the state level about doctors supporting this. And there was a raft of letters in from doctors saying, you never even polled and asked us. It's the executive board saying this. So be very careful about that. Very careful where these figures come from. Another figure I hear is that the United States is now 37th in healthcare in the world. Well, that came from a 2000 study by the World Health Organization, and the person who signed that study, the auditor who signed it, has since repudiated it in print and said it is meaningless. It has nothing to do with what was actually happening. In the United States, one way the statistics are worked is if a baby born, stillborn in the United States, is often rushed immediately to an infant ICU, where the baby may be kept alive for hours or days and then inevitably dies. It was just simply too soon. In the United States, that's infant mortality. Overseas, that's stillborn and taken out of the infant mortality rates. So therefore, it makes it look like infant mortality is much worse in the United States. So you've got to be very, very careful with those figures. The premise of your question was the AARP said it, and therefore it's correct, and I challenge all of that. Remember, too, in the 1960s, doctors made house calls. You can add that to it, too. So I would challenge all the figures and the premise behind it. Go ahead.
My question would be, you say, you want to base this healthcare plan on all that doctors' rights. Well, one issue is, there's a huge asymmetry of information. As a healthcare provider, I know way more about the patients, what's going on than they probably will.
Right.
How would you avoid a doctor, doing extra MRIs on a patient or doing medical procedures that might not really be necessary, but the patient might not have any idea about that?
Well, the idea is that the patient knows less than the doctor. Of course, I don't know anywhere near as much as my doctor. I have to trust my doctor. But in the present day, of course, I'm also printing up rafts of studies. I went to see one of my doctors at Duke, and I walked in with 3 of his studies in my hand and to question him about them. And I pointed out a technical typo in one, which he was taken aback by and happy to see because he wanted it brought up. What do you do when you go to the car mechanic and he says you need something for your car? You make your best judgment. You get the opinion of another car mechanic. Go ahead and do that. I'm getting second opinions now on the other side of the country. And doctors who support that. But there's a certain premise behind the question, which is that the vast majority of people are really, I'm not saying you hold this, but there's a certain premise in the arguments I hear that go this way. That says the vast majority of people in the country are really stupid and therefore have to be protected. Be protected by whom? By bureaucrats who don't practice medicine. It doesn't make any sense, right? And so the answer is an informed populace. And I also question something else too. Too many MRIs are raising prices? Would you say that too many people using computers is raising computer prices? I would look forward to the day when every American would have an MRI every 6 months and a PET scan once a year. Right? If that were to happen, the cost of the equipment would fall dramatically by economies of scale. The cost of the tests would fall dramatically by economies of scale. And they'd be more and more affordable, as in every other industry in which the first new entry into that industry is very expensive, and then gets cheaper, less and less expensive, the more it is being done.